Hello everyone, let's look at working in a hospital and in a care home. What are the differences? Let's look at the pros and cons working in a hospital and in a care home. Sometimes it is very difficult to make the choice where to work, and in this video I'm going to address that. My name is Mordecai. I'm currently a registered nurse working with an NHS hospital. Prior to this, I worked in a care home for 3 years. So I'm going to tell you about my experiences as well. Please, you are welcome to the Nature and Lifestyle channel on YouTube. And guys, please do subscribe if you're new here. And for all returning subscribers, thank you very much for coming to watch my video always. There are so many types of health facilities in the UK. We have our usual hospitals where people with acute illnesses and sometimes chronic illnesses are taken care of, okay? And in the hospitals, it's either you are fully treated or you are treated to attain some level of stability with your illness, okay? So these are hospitals. Now, we also have private care homes or nursing homes where people with chronic illnesses are taken care of. And in care homes, we usually have the elderly patients there. We also have some care homes that take care of people with learning disability as well. Care homes patients usually have chronic illnesses. They don't have the acute illnesses. When a resident in a care home gets any acute illness, they are usually transferred to a hospital for treatment. Then when they get well, they are transferred back to a care home. We also have the hospice, okay? Now, hospice are places where they take care of people who are in end-of-life care or people in palliative care. Then we also have the GP practices where we have the community general practitioner attending to people with non-urgent medical conditions. So we have several health facilities in the UK. Now, just as I said, this video is going to concentrate on NHS hospitals and privately owned care homes. Now, with regards to hospitals, there are private hospitals in the UK as well, but most hospitals are owned by the NHS. Now, care homes too, there are government-owned care homes in the UK, but most care homes are privately owned as well. Let's now look at the main differences between working in a private care home and in an NHS hospital. The first one is career progression. You realize that when you work in an NHS hospital, there are clear career progression pathways, okay? NHS hospitals are designed to help nurses and senior carers progress very easily in their nursing career. And in an NHS hospitals, these are done in two different ways. The first one is in the hospital, we have an internal online learning platform where you can learn about advanced nursing skills, where you can do so many nursing related courses, okay? So these online learning platforms are available in almost all NHS hospitals. There are some NHS hospitals too that will help you further your education in universities to study nursing related courses, okay? They will help you go into specialty areas. They are very good with this. This is not the same when it comes to private care homes. You realize that in care homes, you do some few courses, and some of those courses are not even advanced nursing courses where you can learn more about advanced nursing skills, okay? Also, there are learning platforms in care homes, online learning platform I mean, but it is not the same if you compare to that in an NHS hospital. So when it comes to clear career progression, I would advise you to select NHS hospitals. The next main difference is money, how much you are paid at the end of the month, or how much is your hourly rate. You realize that in care homes, the hourly rate is very good as compared to NHS hospitals. Now, in care home, a band 5 registered nurse can earn between £16 to £22, and a senior carer can also earn between £10 to £14. This is not the same when it comes to NHS hospital. A band 5 registered nurse in an NHS hospital usually earn between £13 to £16, okay? Then the senior carer in an NHS hospital will also earn between £8 to £12. If you want to earn more money, I would advise you to work in a private care home. The next topic is nurse to patient ratio. Nurse to patient ratio. You realize that in a care home, okay, one nurse can take care of about 20 residents, sometimes 30, and I know care homes that even take care of 40 residents in the night. One nurse, you are taking care of 40 residents in the night. Guys, it is not easy when it comes to patient to nurse ratio in care homes. This is not the same in NHS hospital. On a typical ward in an NHS hospital, unless there is acute shortage of nurses, okay, but on a typical ward in an NHS hospital, you will take care of 8 or 6 patients with your healthcare assistant. 8 or 6 patients with your healthcare assistant. So when it comes to patient to nurse ratio, I will go with NHS hospital. The next one is promotion. This one too favors NHS hospitals because you realize that in an NHS hospital, it is easy for you to get promoted, unlike a private care home. So let me give this example. If you are a band 5 nurse in a hospital, okay, you can easily be promoted to band 6. If you have the experience, if you have the confidence, you can apply for a band 6 job, and depending on your performance in an interview, you will get promoted, okay? Band 6 can also be promoted to band 7, then band 7, it goes up. This is not the same when it comes to private care home. You realize that there are a lot of experienced band 5 nurses in care homes, but they don't get any promotion because there are not many promotion pathways, okay, when it comes to care homes. In a typical care home, we have the nurse manager, the deputy nurse manager, the clinical lead, and the band 5 nurses. That is it. So no matter how experienced you are as a band 5 nurse, if the clinical lead position is not vacant, you will never get promoted, okay? Because of this, we have band 5 nurses who have worked for 5 years, 10 years, 15 years in care homes that haven't had any promotion. Now, the next thing is you specializing, okay? Speciality. This one also favors NHS hospitals. You realize that in hospital, because we have so many specialty areas, if you are not comfortable in the ward you are working with, you can move to another specialty area. So we have the respiratory specialty, we have cardiology specialty, we have spinal, we have neurosurgery, we have orthopedics, we have stroke, okay, we even have intensive care units, we have endocrine specialty. So if you are a registered nurse in an NHS hospital, there are so many avenues where you can specialize. This is not the same when it comes to care homes. In care homes, there are no specialty areas, okay? So you are just on the ward, you are taking care of your dementia patients or patients with other mental health illnesses. Or if you work in a care home that takes care of learning disability patients, that is the only thing you'll be doing, okay? So you can be working in a care home for 5, 10, 15 years and you will not specialize. You just remain at the same place where you work. But in hospital, there are so many specialty areas where you can specialize. Another area is sick leave and maternity leave. Sick leave and maternity leave. With regards to this, you realize that it also favors to NHS hospital workers, okay? NHS hospital workers. Now, in most care homes, when you call in sick, you are not paid, okay? In most private care homes, you are only paid when you come to work. If you don't come to work, you are not paid. Also, with regards to maternity leave in care homes, it is not the same in hospitals. In care homes, the maternity leave is not that long, okay, in care homes. Yes, you can spend about 9 months with your maternity leave, but how much you are paid would decrease in time. How much you are paid would decrease in time. This is not the same when it comes to NHS hospital. Now, in an NHS hospital, depending on the sick policy of that hospital, you can call in sick for a couple of times and you still get paid, okay? You call in sick a couple of times and you still get paid. With regards to maternity leave in NHS hospital, you realize that you are paid for a longer period of time as compared to being on maternity leave in a privately funded care home. The next difference is how breaks are paid. You realize that in private care homes, most private care homes, when you go for break, you'll be paid, okay? That is, you receive your 12 hours pay in most private care homes. This is not the same when it comes to NHS hospitals. Most NHS hospitals will not pay you when you go for break. Guys, they will not pay you. So if the ward is very busy and you are not able to take your break, it means that, guys, you will not, you've worked just in vain. You've worked in vain. You will not be given your 12 hours pay. They will subtract the number of hours you were supposed to go for break and pay you for the rest of hours that you are supposed to work. So when it comes to paying break, I'll go for privately funded care homes, okay? The next one is parking. You realize that in care homes, you get a very big parking space where you park your car. Most care homes will not charge you when it comes to parking. But guys, almost every, and I don't understand why, almost every NHS hospital will charge you for parking. And sometimes, even if you don't pay, you'll be issued a ticket, okay? This is very, very bad when it comes to working in NHS hospital. So for those who drive, okay, bear in mind, if you work in a care home, there's more likelihood that you not pay for parking. But if you work in an NHS hospital, you will have to pay. Another difference is pension. And here, guys, the NHS pension is better than most pension in private care homes. NHS pensions are superb. A lot of nurses who have gone on retirement have testified to this. When you work in an NHS hospital or any NHS health facility, you realize that your pension payment at the end of the month is very good. So when you go on retirement, you get a very good pension salary. Another difference is discount and benefit. This also favors NHS workers. If you work in an NHS hospital, you have access to so many discounts and benefits on so many products. I personally have used my NHS discount to buy footwear with Adidas, okay? The footwear was supposed to cost £95, but because I'm an NHS worker, I bought it at £55. Something that most care home workers will not get access to. So in an NHS hospital, you get so many discounts and benefits. You can apply for your blue light card that you can use it to buy so many items in so many shops at discount prices. This is not the same for workers in private care home. Also, healthcare assistants in NHS hospitals have clear chances to become nurses, unlike senior carers or carers in care homes. If you're a healthcare assistant in an NHS hospital, you can do some courses, okay? And the hospital can sponsor you to do a nursing program in a university so that you become a nurse. Thank you very much for watching today's video. Guys, thank you very much for coming to watch today's video. And so these are the differences between working in a private care home and in an NHS hospital. My name is Mordecai. Kindly subscribe to this channel if you haven't done so. And see you another time with another interesting video.